And welcome to A Deadly Silence. I'm your host, Larry Curtis, and it is our goal to expand on the education and awareness of both the drug and alcohol addiction that has affected the city of Brockton and the surrounding communities in the South Shore. Today, we have with us a guest from the Brockton Mayor's Opiate Overdose Prevention, Hillary Dubois.
Hi.
Hillary, welcome to our program.
Thank you for having me.
Could you tell us a little bit about the Mayor's Office of Opiate Overdose Prevention? Prevention, I'm sorry.
Absolutely. We are a program that is funded through the Department of Public Health's Bureau of Substance Abuse Services. Basically, the state of Massachusetts was looking at the rising and consistent numbers of fatal overdoses through the Commonwealth. And so the way they reacted was they applied and received federal funding to work solely on reducing the number of fatal overdoses in the state of Massachusetts. Brockton was one of 15 communities that was selected for this grant, and it's a 3-year grant. And my sole job, my 40 hours a week plus position, is working to reduce the number of fatal overdoses in the city of Brockton.
What year are we in with that grant right now?
We're in year 3, so we've got hopefully another full year through supplemental funding through the government.
Okay, and I'm assuming there are people behind the scenes trying to get additional funding to keep this vital program going in the city.
Absolutely. It's very important, and we've done a lot, but there's still a lot of work to be done, certainly.
Absolutely, positively. So tell us about the program.
Sure. Basically, what my job is to go throughout the city and educate people, give out information, create awareness. I've worked with the Brockton Police Department, I've worked with Brockton Fire Department. We have a staff who works in the Brockton Hospital emergency room who helps facilitate getting people who have suffered from an overdose, getting them some services. I work with the Brockton Public Schools, I've gone into the mainstream high school, I've gone into the alternative school, and then I also just do outreach on the streets, going out in the woods, finding people who are in active use, going to the Brockton Fair, finding people who've maybe come from surrounding towns, and I work with High Point Treatment Center, and I educate people who are in treatment at the Men's Addiction Treatment Center, which is the 30-day Section 35 program, as well as the voluntary program, and I oversee the clinicians at MATC, the Men's Addiction Treatment Center, the Brockton Addiction Treatment Center, and the Castle, which is adult.
So the High Point MATC program that we have here in Brockton, I think it's on the south side.
Yep. Meadowbrook Road.
That's your work.
Yeah.
That's a really important program as an outreach for families who may find themselves having to deal with an addiction. You had mentioned something about Section 35.
Yep.
Can you kind of educate us as to what that really means?
A petition for a Section 35 is a civil commitment, an involuntary civil commitment, for up to 30 days. And basically you'd go into the court system and you would petition for a Section 35, and a judge would hear your case and would either grant the petition saying that predominantly the reason that the person needs to be put into treatment for 30 days is because they're at risk for serious harm to themselves or others because of their addiction. So you do have to go through the legal process. The courts are involved.
So to some extent, the addict has certain rights that he needs to have basically taken care of.
Yeah.
Before, you just can't say, take my kid away and put him behind bars.
No, not at all. They have to be found to be a danger to themselves or others. A family member could petition for a Section 35, a police officer, the hospitals, and someone could petition for a Section 35 for themselves. But where we're really unique is of the 15 communities that were funded, I work for the city of Brockton. I can work with the city of Brockton really pretty much exclusively, but there's people coming from all over the state of Massachusetts, men coming, from Adams and Great Barrington and the Vineyard, who otherwise maybe never would come through Brockton. They now have the opportunity to get this education and to leave their treatment facility with nasal Narcan, which we'll talk a lot more about. But when we're talking about opiate addiction, it can be a matter of life and death, and it's not available as widely through the state.
What are opiates?
Opioids and opiates kind of get used interchangeably, but really they're anything that comes from the opium poppy or anything that's synthetically manufactured by a drug company, usually in the form of a painkiller. They're depressants. They depress and repress the central nervous system. Examples of them are things like heroin, morphine, and codeine, which come from the opium poppy, or OxyContin, Percocet, Vicodin, that are all synthetically manufactured. It's also important to know that both methadone methadone and Suboxone, which are used to treat addiction in a form of maintenance, are both opioids. And you can overdose from any of them the same. So you could overdose from codeine the same way you can overdose from heroin. You can overdose from any prescription medication that's an opioid. So it's important for people to know that.
So to some extent, the treatment that is available to the addict is in itself an opiate, and
It is.
It's just interacting, I guess, with the brain a little differently.
Yeah, basically, it's in a maintenance form. The person's on a dose that allows them to function, go to school, go to work. It takes away a lot of the criminal justice aspect, usually because someone doesn't have to feed their habit. They're going into a treatment facility. Usually they're getting counseling and other, services that hopefully will work towards recovery.
And is this geared toward a weaning off of the opiate over a period of time? Is that a way to look at it?
Yeah, absolutely. Yeah. So it's really about keeping their cravings away and allowing them to, get through the process and hopefully get some treatment and, whether that's group or individual counseling, and work on the issues of their use, but they don't have to deal with the physical craving.
What is an opiate overdose?
Okay. So basically what happens are when we use opioids, whether we're using them to get high, an illicit drug like heroin, or if we're taking them as a pain medication for legitimate pain, basically, I go back to biology 101. Receptors are something in our brain that send messages, and opioids fit into the receptors. So if this is a receptor in our brain, opioids fit into the receptor. And we have 3 responses to an opioid in our brain. If we're in pain, it helps the receptor to send a message that we're not in pain anymore. Even if we're still in pain, we could get sick from it. Our body doesn't react well to it. We could vomit, or you get a very euphoric high. Now, what happens though is when you have too many opioids in your system, the receptors are too busy processing the opioid to do what they're meant to do, and that's to send a message through our body to maintain all of our vital signs, most importantly, to maintain respiration. So what happens in an opiate overdose is that someone doesn't get enough oxygen because that receptor is not sending the message, and the person essentially suffocates. So all of our vital organs that require oxygen, our heart, our liver, our lungs, our brain, our kidneys, they don't get the oxygen that they need, and they'll start to shut down. What's really important to know about an overdose is that it's a process. And what that means is that there's time to intervene and to save someone's life. A lot of times what we know about overdose is what we see on TV or what we see on the movies, and that someone uses, usually it's in a dark alley, someone injects heroin into their arm, they die. Boom. But that's not...
The ejection, they kind of get this relief and then
boom,
collapse.
But that's not necessarily how it happens.
That's the movies.
Right, that's very sensationalized. So what really happens is the person's slowly not getting enough oxygen. Now someone could use and then could shortly thereafter fall out into an overdose. Or someone could use and more commonly fall out into an overdose up to 3 hours after using, which is not something a lot of people know. What they've actually found in all the research that they've done are that most fatal overdoses happen in that 1 to 3 hour time period. Now, I think a lot of that has to do with the fact that people don't know they can overdose up to 3 hours after. They think they're okay. Maybe they do use with people, but then they go home and they go to bed and they're in their house or their apartment or wherever alone. Or maybe they leave a situation that's safe and they don't realize they could fall out and they fall out into an overdose. So it's important to know that an overdose is a process.
What would be signs of an overdose that, a family member, or if you're out in a club or a house party, what are the signs of an overdose?
Absolutely.
That we need to know about?
Certainly. The signs of an overdose on all opiates are the same. So whether it's an overdose on codeine or whether it's an overdose on heroin, it would look exactly the same. It would also look extremely similar to an overdose on benzodiazepines, so drugs like Ativan, Xanax, Klonopin, Valium. And it would also look pretty similar to someone who has alcohol poisoning.
Prescription drugs we can find in medicine cabinets.
Maybe if you're prescribed them. They're drugs that are prescribed usually for people who have anxiety, maybe have a tough time sleeping, that, maybe you have anxiety about going on a plane. Those types of things would cause you to be prescribed them, but they're also widely abused, and they're very commonly abused with opioids. Mm-hmm. So if someone had alcohol poisoning, or if someone had an overdose on opioids, or if someone had an overdose on benzos, it's all going to look pretty similar. The most common sign that someone is in an overdose is a blue tinge to their lips and to their fingertips. But what's important to know is that there's a whole host of symptoms that someone could have. For example, somebody could be awake but not able to respond. So people could actually be walking around talking, turning blue and overdosing at the same time. That's not something that people often associate with an overdose, but it does happen.
Is that tantamount to like a zombie effect of somebody walking
know,
around? I don't know.
It kind of can be, and when we talk about Narcan, it's been described to me as Night of the Living Dead, so it kind of fits.
Okay.
But someone's face would usually be very pale, gray, or ashen. If you were to feel their skin, it would feel really cool and clammy to the touch. Their pulse and their breathing would be slow, stopped, or erratic. They could be passing out. They could be in a very, very deep or heavy nod, which is, that kind of effect that often is identifiable by someone who's abusing opioids, which is that kind of, I'm falling asleep, no, I'm awake. I'm falling asleep, no, I'm awake, that type of thing. So they could be going practically to the ground and coming back up, throwing up, foaming at the mouth, convulsing. They could also be making a gurgling, choking, snoring kind of sound. It's very loud, it's very distinct. Basically, the person's aspirating. But someone who's in an overdose could be doing any of these things in any combination. So it's important to know that there's a whole host of different symptoms.
So how would I, or anybody out there who's at a party and you look over in the corner on the couch or the chair and there's Joe or Mary kind of just laid back,
Yeah.
and, it's 11, 12, 1 o'clock in the morning, you think they're just, snoozing.
Yeah.
What should they really do? How would they kind of know whether or not they're just taking a time out or whether they might be overdosing?
Absolutely.
Yeah.
Well, over a period of time with this being something that happened, they have actually found that doing the sternum rub is one of the most effective ways as opposed to hitting someone or slapping someone. And what the sternum rub is you take your knuckles and you rub them up and down the person's breastbone. Push down hard. It's a really uncomfortable bone-on-bone action. And if they don't respond to that, they're not going to respond. If you can't reach the breastbone because maybe someone's got a lot of layers on, you can do above the nose, under the nose and above the upper lip. Same thing, push down hard, it hurts. If they don't respond to that, they're in an overdose. And another thing...
So you're, in essence, inflicting some pain,
well, yes.
but in the hopes of,
Right.
making sure the person isn't overdosing.
Absolutely. That hurts. Sometimes I'll do 5 and 6 trainings in a day, and I'll be driving home, and I'll be like, what did I do to myself? This really, really hurts. And for whatever reason, it's a different type of pain. So it usually should help bring someone out of it. If you do that and you're still not sure, what you can do is say the person's name loudly, tap them on the shoulder and tell them that you're going to administer Narcan to them, which we'll get into. But for anyone who has any self-control over the matter, they're going to respond to you and they're going to tell you that they're fine, you're not going to administer Narcan to them. So those are 2 big things that you can do, as opposed to just, trying to feel for a pulse or whatever. These things, if they don't respond, they're not going to respond.
And at that point in time, the person is probably into an overdose.
Probably in an overdose, and we need to do what we can to save the person's life.
Oh my God! Guys, Natalie!
What?
She's okay?
She's fine.
She's fine.
She doesn't look fine.
She looks like she had one too
Check
many.
her pulse to make sure she is fine.
Yeah, just.
She's
You know what?
just
Actually,
sleeping.
someone get me a marker.
No, she looks like a dummy.
Yeah, she'll sleep it off. She's fine.
Yeah, just. She just needs a good night's
We
sleep.
should call an ambulance. She
No,
looks
she's
not calling
fine.
an ambulance.
She looks incoherent. We need to
Incoherent. She
No,
looks like she's
she's
passed out,
fine.
dude.
What did she have?
She won't like
how much you can
She
do
had
that?
a couple pink ones and then a couple
No,
orange
no, we
ones.
need to
And
call
the
an
light
ambulance.
We
because
all
she's taking
did.
alcohol
But it's
and pills.
fine.
We don't need to get. We don't need to get in trouble.
I'm okay.
So
No,
we're
you're fine.
We don't need to get in trouble. So you can't because you're
We'll
careless.
just drop her off at her house. I'm not trying to get in trouble.
Thanks a lot.
So in the event of an overdose, one of the most important things to do is to call 911. And when you call for help, it's really important to mention that the person is not breathing. Because in the event of an overdose, someone's not breathing.
Can I interrupt there
Sure.
for 1 second? Certain times people feel that if they call 911, they're going to become involved and
Right.
the cops are going to come in. I
Certainly.
mean, what's the myth behind that? Aside from trying to save the person who's overdosing, obviously, but
Well, usually the job of the police is to secure a scene. And what people are afraid of is in the event of an overdose that the police will come, that there will be arrest made, and it's a possibility, but there are things that you can do to limit police involvement. If people are afraid that they don't want the police to come, that's not a reason, though, to not call for help.
Obviously.
One of the things that you can do is you can call the fire department directly or the ambulance company directly. For example, Brockton has a contract with American Medical Response.
Yep.
I could call them directly. The fire department and the ambulance will come together, and the police won't come to the call. But it's important, regardless of who you call, to say that the person is not breathing, because that's what's happening.
Right.
You don't need to say the word overdose on the phone. In a lot of instances, that will actually be something that can bring police, because now, in addition to it being a medical emergency, it's also a law enforcement issue.
Right.
Another thing that's important to know, if you ever have the option of calling from a landline or a cell phone, you always want to call from a landline. A cell phone goes to the nearest police barracks, so you're going to have to wait for them to transfer you to the local 911 dispatch. It wastes crucial time.
Crucial seconds and
Absolutely.
minutes. Right.
So if you have the option, call from a landline.
Okay.
But if I found someone who's fallen out into an overdose and I need to go and call 911, I need to go unlock the door, I need to go grab my Narcan, I need to leave them for any reason. If I leave him flat on his back, he's at risk for throwing up, foaming at the mouth, and then having it slide back down his throat and essentially him choke on his own vomit. Nobody should die that way. So I need to put him in a position where he's not at risk for further harm. And so that's the recovery position. Most people who you're going to find in an overdose are probably going to be in some form of lying down. So if they're flat on their back, what I need to do...
If they're not lying down, sitting in a chair, should they be...
Yeah, get them flat on their back.
Flat on their back? Okay.
Because when we talk about doing what we need to do to save someone's life, they should be flat on their back, okay? But I need to go and unlock the door so that the paramedics can come through, and I can't leave him like this. So what I need to do is put him in the recovery position. And basically all that entails is rolling him up over onto his side. Now, when I roll him up over onto his side, the most important thing is that I make sure that this top knee is flat on the ground. That acts like a brake. So if he were to try to roll out of the position, if he were to go into convulsions, any of these things, he actually can't get out of this position until he's strong enough to pull himself out. But I don't want to leave
Which would be a recovering
yes,
side.
exactly.
Okay.
That would be a good thing.
Yeah.
So I want to make sure an arm's out flat. Take the other hand, put it on the upper arm, make sure that his mouth is open and pointed downward. This way, if he's going to throw up or if anything's going to happen, gravity's going to take care of it. But for everything else, when we talk about saving someone's life, they should actually be flat on their back, which is really important to know.
So that's a recovery position,
That's if you're
allowing you to, if you're by yourself and you can't say someone call 911, get the door open,
Yeah.
this is the way for you to ensure that he's not going to basically choke.
Yep, that he'll be safe while I go and do that, so I can come back
And come back and
take care of him. Exactly. So when we talk about saving someone's life in the event of an overdose, the most important thing to do is to rescue breathe. And a lot of confusion comes with, do I do CPR? Do I rescue breathe? What does that work? We just do rescue breathing. And basically what we need to do is get oxygen to the vital organs, etc. So what that entails is making sure there's nothing in his mouth. So if I saw anything solid, I'd use my pointer finger, make a hook, pull it out. If it was kind of liquidy, because people do foam at their mouth, you could just roll them over onto the side, kind of let gravity take care of it, okay? So while they're flat on their back, I've made sure there's nothing in his mouth. I'm going to tilt his head up. I'm going to pinch his nose. I'm going to put my mouth over his. I'm going to give him 2 deep, slow breaths. I want to see the chest rise and not the stomach. If I see the stomach rise, I probably haven't tilted the chin up high enough.
so by pulling the chin back, you're opening the airway?
And
Is
allowing,
that basically,
yep,
okay.
exactly, oxygen to get to him. So if I had Narcan, at that point I would administer it. If not, I would continue to breathe for him 1 breath every 5 seconds, either until he started breathing on his own, which could happen, or until help arrives and was able to take over. So that's what we would do up to the point that we were able to administer the Narcan.
Hillary, as we saw in our demonstration, you had mentioned the use of Narcan as
Yep.
part of the recovery process.
Yep.
What is Narcan and how does it work? You know.
Narcan, or naloxone, which is the generic form of it, is a complete opiate antagonist used solely for the purpose of reversing the effects of an opioid overdose. It's completely safe and effective. It can be used on pregnant women. It can be used on children. It's actually so effective that they've used it on 4 state police narcotics dogs. So the dogs go into a drug bust, they get aggressive, they're there, they find it, they inhale it, they ingest it, and now the dog's going to die.
Because they're sniffing.
Because
They're
they're
sniffing for
sniffing.
drugs, and
That's
they're
exactly.
inhaling exactly
Yeah, and
what-
it's like a game to them. So, you know, now the dog's ingested heroin, for example, and the dog's going to die of an overdose if you don't do something. So they've actually used the nasal Narcan on these 4 police dogs and saved the dog's life.
Wow.
So to me, if it's that safe and effective, you know, it could be used on me. And when we talked a little bit earlier about different substances that are used in drug treatment, a lot of negative things come up about them. You know, methadone and Suboxone, they're still opioids, so people can abuse them. You can't abuse this stuff. It's not going to get you high. It's just going to prevent you from getting high. Which
So there's no way to overdose on
No,
administering a Narcan.
there's no such thing as giving someone too much Narcan. So what Narcan does is, remember when I talked about the receptor and
Yep.
the opioid in the brain? So it goes into the brain and it has a greater affinity to the receptor than the opioid does. So basically all it does is pop the opioid off the receptor, fit into the receptor, blocking the opioid from going back into the receptor for about 30 to 90 minutes. Now, when the opioid's not in the receptor, it allows for the person to start breathing again. It allows for that receptor to send that message, I need to breathe, and basically completely reverse the effects. It comes in 3 forms. The Department of Public Health has 8 Narcan pilot sites where you can go in as long as you're over the age of 18 and you can say, I'd like to get some Narcan. It's completely free. It's a confidential process that they use nomenclature. So you're not saying, you know, hi, I'm Hillary Dubois, please sign my name and attach me to this. No. It's the first 3 letters of my mother's maiden name, and then the first and third letter of my first name, and the first and third letter of my last name.
So it's a code that they
it's a
use to
code.
just keep track of what they've made available, and
Exactly.
it has no bearing on the individual who would
Nope.
be asking for the
Exactly.
the safety valve.
Exactly. And Narcan is a prescribed medication. So aside from these 8 pilot sites that are in, we're lucky enough to have one in Brockton, which is really, I mean, it's a huge thing that we have both a coalition working on overdose prevention as well as a nasal Narcan site. There are shared sites in New Bedford and Fall River have a shared site. Hyannis and Provincetown have shared sites. Springfield and Northampton have shared sites. Then Quincy, Boston's covered, Cambridge, Lynn, and Gloucester. So it's really not covering much of the state. But we're lucky enough to have one, 81 Pleasant Street, right across the street from here. So basically, otherwise it's a
And anyone who finds or feels that they
Yep.
have a relative, a loved
Yep.
one that may be potentially subject to having an addiction or an overdose,
Absolutely.
they could be able to go in and they could
Absolutely.
ask for this particular product, and they would be given it as a security blanket in the
Absolutely.
event of an overdose potentially.
Exactly. As long as you're over the age of 18, it's for free. The way that I look at Narcan is, my brother's allergic to bees. We have an EpiPen for him.
Yep.
In the event that he were stung by a bee, it would be a life-threatening emergency. The Narcan's going to reverse the effects of the overdose the same way the EpiPen's going to reverse the effects of the anaphylactic shock that someone goes through. But there's a doctor, a medical director of the Narcan pilot site, Dr. Wally, who signs off on all of these prescriptions. And it's like a standing order because you're really not going to use Narcan on yourself. You're going
Right.
to use Narcan on someone else. So it is a prescribed medication though. And it comes in the nasal form because a few other states have Narcan, and Narcan also comes in injectable forms, but the Department of Public Health, they didn't want to deal with needles. But the 2 other forms that Narcan comes in is most commonly when paramedics administer Narcan, they do an intramuscular shot in the arm or the butt or the thigh. It also comes in an IV form. So someone, for example, might be on a really, really high dose of a long-acting opioid like methadone that stays in your system for a really, really long time. They might need a lot of Narcan. They might actually need to be put on a drip of Narcan for several hours. The same way I can't tell you how much of an opioid it's going to take for someone to fall into an overdose, I can't tell you how much Narcan it's going to take to pull them out of it. But like I said, there's no such thing as giving someone too much. So
the Narcan, in essence, in this example that we're looking at,
Yep.
where we had a person overdose,
Yep.
is really a bridge to respond immediately at the point of overdose that you recognize until the medical assistance arrives. So it's
Exactly.
really a bridge.
it really is, and it's going to allow the person to start breathing again. Now, what's important to note is when you get a kit from one of these sites, there's 2 doses in each kit. On these orange boxes, there is a sticker, and that's required on all of them, and it says that this comes from the Department of Public Health, and it has the Mass General Law, Chapter 94C, that says that this is not grounds for search and seizure, this is not drug paraphernalia, I am legally allowed to have this.
Even though it's a prescribed
It's a prescribed
medicine.
medication. I can have it.
Okay.
There's 2 doses in each kit. There's 2 milliliters in each dose, which is the standard paramedic dose, okay? There's also other things in here, like a little booklet on information. If you get it from the Cope Center, they also have a breathing mask. So for example, you go to McDonald's and someone's turning blue and you want to do something, but you don't know that person and you're a little leery about putting your mouth on their mouth, there's a breathing mask. Rip that out, put it on the person's face, you can breathe for them. Because that shouldn't be a reason that you're not going to help someone.
Right. Mm-hmm.
So basically what Narcan looks like is, in the orange box is the actual medication, Narcan or naloxone, which is a clear liquid. It does have a little bit of a scent to it. And then this barrel that's used basically to ionize it. In a separate sterile package is the nasal tip. And I strongly encourage anyone who gets enrolled in Narcan, you can pre-assemble part of it, because this can be kind of difficult to put together, especially if you're in an emergency situation and you're scared. But you don't want to put the whole thing together, because Narcan that's exposed to oxygen for too long can become a little less effective, and you don't want the stuff to become less effective.
So it loses its potency.
It can, yeah, if it's exposed to oxygen for too long. It's a pop and screw configuration. Everything pops off and everything screws in. So basically what that looks like is you pop the yellow top and bottom off, and then you take the nasal tip and you screw it right in. Now I've done this about 100,000 times, so I make it look really easy. It's not, you know, if you're in a panic situation, this could be really difficult to do. You'd leave it like this, okay? And you kind of want to leave it at room temperature. Because if it does get exposed to the elements, it can be a little less effective. Plenty of people have left it in glove boxes and used it and it still worked. So if you have to use it, you just take the top off, you'd push the barrel into the syringe, you put the tip in the person's nose, and you push half up each nostril.
An aerosol, kind of.
Like Flonase, like anything else, yep. If you do half up each side, it's going to allow for the person to start having the opiates jump off the receptors.
Is there a knee-jerk reaction to the addict or the person who may have passed out?
There might be, there might not.
Okay.
It's totally individualized. So you give the person 2 breaths and you administer the Narcan. Then you continue to breathe until either the person came out and started breathing on their own or until help arrived.
And you're looking for that chest expansion as you're providing breathing for them. Okay.
After about 3 minutes, if the person doesn't come out, you'd want to administer a second dose. Just rip this off, hit them again. There's 2 responses to being Narcaned. The first is to come out and not feel great. The second is that the person could go into withdrawal because the opioids aren't in the receptors. So it's important to know that someone who comes out might not be in a great place, might want to go and use.
Okay.
They won't be able to get high while Narcan's in their brain for 30 to 90 minutes. Once the Narcan wears off, someone could re-overdose or they could be high again.
If they were to be ignorant enough and go out and try to use again, it's not going to be beneficial. Is there a potential of an overdose at that point?
Absolutely. They wouldn't overdose until the Narcan wore off.
Wore off an hour or so later.
Right, but once it wore off,
it would hit them like a brick, potentially.
Exactly. The safest place for someone after an overdose.
So if you use this product, it's best to make sure there's some medical follow-up shortly thereafterwards.
Get them to the hospital.
Yeah, get them to the hospital to be looked at.
It's the safest place.
This has been a great show. I hope that our viewers have learned a lot about what the Brockton Mayor's Office of Opiate Overdose Prevention provides us here in the city of Brockton and throughout the South Shore community. I know you're out there every night. I've seen you at other demonstrations and educational conferences out there throughout the city where you have demonstrated what you did for us tonight and what you hopefully do for everybody out there. I want to thank you for being here.
Thank you.
Hillary, it's always a pleasure to see you and meet with you, and thank you for joining us tonight.
Great. Thank you so much for having me.